Okay, so this is how to clean and then wrap surgery packs. So all these instruments are currently clean, but for the purpose of videos, if all these were dirty, we would want to fill our sink with warm water and some dish soap, get it all bubbly, and put all of your instruments in. When you put your instruments in, so things like these hemostats, for instance, that are currently clamped, you want everything open, so that way our warm water and soap is able to kind of get in there to get any germs and bacteria out of our little grooves. So you want everything open, let them soak in there. Again, you want to do this kind of as quickly as possible after surgery so that you're not having to work on scrubbing off a bunch of dried blood and whatever else. So while those are soaking, you want to turn on your, we call it the shaker, but you want to turn on the shaker because it will get all warmed up. So this is the ultrasonic cleaner is the technical name for it, but all the solution in here helps kill and kind of dissolve any bacteria and stuff that's not being taken off by our soap and our water. So all that stuff, even when you're scrubbing, leaving behind little particles that of course you can't visually see. So that is what this does. But while those are soaking, you turn your shaker on so that it can get warm. Then you want to scrub your instruments. So this is a scrub brush for the instruments. So typically we'll turn the warm water back on so that you can, because you've got soap in here, so that way you're able to see everything, and you want to scrub every part of your instrument. So yes, this down here is what is touching the patient. However, your doctor who is wearing gloves and has been working on the patient, you know, they've got blood on their gloves. So there is going to be blood up here and in other places, not just at the tips of your instruments. So again, we would scrub everything really well. So after I got done scrubbing this, I would then put this in my shaker. Close my shaker, go on to my next instrument, put it in the shaker. You want to rinse, you know, after you're scrubbing and after you've had the soap and stuff on here. Want to rinse with water before putting it in the shaker so that you're not getting a bunch of dish soap into this. So after all of your instruments are scrubbed, they will go in here for 10 minutes. Once your instruments are dried, then you are going to want to wrap them. So every surgical pack has its own tray already. Again, you would want to wash this tray too, because any blood or whatever else, you want to get that off of your tray. So then you have your tray, you have all of your instruments that have been laid out and have been drying, and now they're all dry. So in the bottom of our tray, we always want a towel. And then after that, we will get all of our instruments together. So as far as surgery packs go, there are 3 different kinds of packs essentially. So you've got your large spay and your small spay. Again, the difference between those two is you've got larger instruments in your large spay. So like these little short towel clamps would look more like this in our large spay. And then our hemostats, again, so much longer hemostats than this in our small spay. So larger instruments. Then, of course, if it is a spay pack, it has a spay hook. So this instrument, so that always means that it is a spay pack. Essentially, a laceration pack, which is the second type of pack that we have, does not have the spay hook. So it will still have all the same other instruments, but it will be lacking the spay hook. And then the third pack is the iPack. It is the only pack that is different. You will know it when you see it because it has a bunch of little tiny itty bitty tools that look completely different from majority of these. You will still have things like hemostats or towel clamps or your thumb forceps, but the majority of the instruments in there do not look like the rest of these. So that is difference in how to tell large spay versus a small spay, and then again a laceration pack. So after all of your instruments are dry, you have your towel in here. Then if it is a spay, we typically will loop everything through the spay hook just to help keep things kind of nice and organized, and so the doctor is able to see all of their instruments. It's easy to just slide your spay hook out, and then you have free range of all of your instruments. So you can loop all of your instruments on there. Typically we will at least do our 4 Alice tissue forceps. It is good to note too that majority of everything is in 4s. So our big ones first, so our Alice tissue forceps. After that, you can do your straight hemostats. And then your curved hemostats. And then your towel clamps. So again, some people will do the towel clamps kind of off to the side. You can also, however, loop these onto your spay hook. And again, you can loop your scissors, kind of whatever will go through your spay hook. And then you're going to put the instruments that are loaded on your spay hook into the pack so that they are laying. And then you've got 2 pairs of scissors. So you have Metzenbaum scissors, which are these smaller, thinner ones, and then your Mayo scissors, which are your larger ones. So there should always be 2 scissors in every pack. Then you have your needle holders. So this is what holds our suture needle. These are always in every pack. You have thumb forceps in every pack, and then your scalpel blade handle, again, in every pack. Every pack, no matter what, always gets a drape, gauze, and a sterilization strip. Okay, so after we have our instruments in, every pack always gets gauze. About 20 squares, so I'll typically measure it's about 3 finger widths of gauze. You don't want to put a ton because it's wasteful if, you know, your doctor's not using it. We have singly wrapped bundles of gauze too, so if they need more gauze than what is in their pack, they are able to get that. But you don't want to bloody up a bunch of gauze. Then every pack also gets a drape. So every pack gets a medium drape. So when you're pulling from your box, you've got your medium line. So every pack gets a medium drape. The eye pack will get a small drape. And then again, we also individually wrap small, medium, and large drape. So if you need a larger or smaller drape than what is already in the pack, your doctor is able to access that. And then a sterilization strip. And this again goes in every single pack, and you always want that to be on top. So these I already have folded. So our drape, our gauze, our sterile strip on top, so that way when the doctor opens the pack, they're able to look and see that all of the instruments they're about to use have been properly sterilized by looking at the strip. And then as far as wrapping, you can have 2 pieces of cloth. So like this material, you can have 2 pieces of drape. You can do some cloth and drape mixture, but every pack gets double wrapped. So in this case, we're going to use drape on the inside, just since we have some, and we'll use this cloth on the outside. So wrapping, you want to wrap like an envelope, essentially. And always do little tabs, so that way it's easy to open and you're not having to reach into the pack. our tab. That is. There are two types of masking tape, so regular masking tape, and then there is the autoclavable tape, which has these little lines on it. So when this pack has been through the autoclave, these lines will turn black. So again, that lets us know that this is a pack that has gone through the autoclave. Then you want to secure with masking tape. And then you write on your pack what type of pack. So this one was a small spay, so we would label it small spay. You write the date and then your initials. So in case something is missing, then we kind of know who to come to let you know, so that you're able to correct it for next time. That's how to wrap a surgery pack.